Welcome to the Health Science Building here at Southeast Community College. The building opened in November of 2019 and it houses 18 health science programs that are in high demand for our community. We service a 15-county service area here in the southeast corner of Nebraska. When we were designing the building, we really wanted an overarching design to allow it to function as real to life as we could for the students in the professions that they would be entering, as well as to create collaboration and interaction among programs and remove the silos that we sort of put ourselves in higher education and healthcare. Southeast Community College decided that health sciences would be one of its first buildings to build as a standalone building because of the demand in our community for healthcare professionals. All of these professions that are in this building all have a high demand in our workforce right now, especially in rural Nebraska, and many of them we are struggling to meet the need as we graduate classes. And so the health science building allowed us to increase enrollment, provided students a more real-to-life environment for them to learn in, and provided state-of-the-art updated equipment for the programs to really teach the students on equipment they would be seeing in the real world. One of the things that we knew we would have to really look at and be intentional about purchasing is technology for the building. We took into account affordability. It needed to be cost effective. We knew we would be either using grant funding to purchase it or community tax dollars, and so we wanted to be fiscally responsible with what we purchased. We also looked at ease of use, knowing that there's 80 to 90 faculty that would use this and hundreds of students. It needed to be something that was easy to use, that was something that they would be attracted to and want to go and play with and work with, and that they couldn't break it. Ultimately, we selected Intelligent Video Solutions and their Vault system that they have. We found it to be easy to use, cost effective. The renewal was something that we could afford and was really fiscally responsible for our community and taxpayers. And the faculty all found it to be their first choice in really providing them something they would use and they found value in and could see a fit for each of their programs.
We do utilize Vault for a lot of self-reflection. We record the students as they're doing, even practicing, but when they're testing as well. And once we have that recording finished, if they have anything in the middle that we want to mark, if they do something really great in the middle, we'll say, hey, great job here, really followed your infection control. Or if they had something that we want to watch, we can mark it. So when we're reviewing, if we missed it, we can go back really quickly to that so we can grade it quick. Send the link to them, we just copy and send it in an email or a message to them. They do a self-reflection at home, and then they can just send us the paper, email it to us, and then by class time it's ready to roll. We don't have to waste any time in class doing any of that. So they can kind of grade themselves, they learn from it, they see their mistakes.
Then they're also able to review my video of demonstrating the skill, which cuts down a lot on emails and phone calls to me to have me come back in and demonstrate those skills. Students then benefit because we have more time to spend with them one-on-one because we're not in here testing them for hours and hours at a time. I can do my grading at home at 8 p.m. I can do my grading wherever I want to do my grading. And so it helps me to be flexible with my time, which helps them because then I have more time to spend with them.
The IVS team was amazing. They were a great group of people to work with. They came in early in the design. I would say they were probably here about a year before the building opened and involved in determining camera placement, program need based on what they would be using it for. They really challenged us to be innovative in our thinking beyond just what we had used video capture for and to consider different things in our labs and in our learning spaces that we maybe wouldn't have thought of. One of the things I highly value about IVS is their support, and we have loved working with them. We haven't yet to have a problem that they're not willing to solve. They work really closely with our IT department, and the one thing I really liked in implementation that they've continued is they've embraced our innovation and they've desired to meet us in that and create opportunities for students that that aren't happening at other colleges, and provide students learning that allows them to have the flexibility and the access, even off campus, to their learning. And that for a student is really valuable in this day and age. They are busy individuals, many of them working and having families while they put themselves through school. And so that flexibility, that support from not only their teachers, their educators, the programs, the college, but also from IVS, from that they don't maybe realize has been priceless to us.